Good evening. Welcome to this edition of the 401 Talk Zone radio show. My name is Leon Jones. Tonight's topic, I'm going to talk about eating disorders, the signs, symptoms, and risk factors. Now, when we define an eating disorder, there is a commonly held view that eating disorders are a lifestyle choice when that is furthest from the truth. Basically, eating disorders are actually serious and often fatal illnesses that cause disturbances to a person's eating behaviors. Obsessions with food, body weight, and shape may also signal an eating disorder. Now, common eating disorders include anorexia nervosa, bulimia nervosa, and binge eating disorder. Now, with every disorder, there are signs and symptoms. So I'm going to get to the signs and symptoms of what an anorexia nervosa is. Now, people with anorexia nervosa see themselves as overweight even when they are dangerously underweight. People with anorexia nervosa typically weigh themselves repeatedly. It's like they're obsessed with the scale, and they severely restrict the amount of food that they will eat, and they eat food in small quantities. Again, they eat food in small quantities of only certain foods. Now, anorexia nervosa has the highest mortality rate of any mental disorder. While many young women and men with this disorder die from complications associated with starvation, others die of suicide. In women, suicide is much more common in those with anorexia than with other mental disorders. Now, the symptoms that are associated with anorexia nervosa, you may have heard some, they're very common. Well, you have extremely restricted eating. There's emaciation, which that means extreme thickness. You also have a relentless pursuit of thinness and unwillingness to maintain a normal or healthy weight. Intense fear of gaining weight, distorted body image, self-esteem that is heavily influenced by perceptions of body weight and shape, or denial of the seriousness of low body weight. Now, other symptoms over time will come into play, and they include the thinning of bones, which that is osteopenia or osteoporosis. Then there's mild anemia and muscle wasting and weakness, brittle hair and nails, dry and yellowish skin, growth of fine hair all over the body, known as lanugo, severe constipation, low blood pressure, slow breathing, and pulse. Also, there's damage to the structure and function of the heart, brain damage, multi-organ failure. There's a drop in internal body temperature that will cause a person to feel cold all the time. There's the sluggishness, the lethargy, and feeling tired all the time. And for you women, there's infertility. Now, going to the opposite side of the coin, there's bulimia nervosa. Now, people with bulimia nervosa have recurrent and frequent episodes of eating usually large amount of food and feeling a lack of control over these episodes. This binge eating disorder is followed by a behavior that compensates for the overeating, such as forced vomiting, excessive use of laxatives or diuretics, fasting, excessive exercise, or a combination of all these behaviors. Now, unlike anorexia nervosa, people with bulimia nervosa usually maintain what is considered a healthy or relatively normal weight. Now, symptoms included with bulimia nervosa include chronically inflamed and sore throat, swollen salivary glands in the neck and jaw area, worn tooth enamel, and increasingly sensitive and decaying teeth as a result of exposure to stomach acid. Now, being that you have that problem with decaying teeth, when you vomit, acid actually comes up from your stomach, and that's when your tooth enamel gets wasted away, your teeth start to decay, and this is why you got to be careful when you vomit. A lot of people don't know that. You've seen a number of people who are missing teeth and they have rotten teeth or decaying teeth. At one time, they may have had a bulimia nervosa. You also have an acid reflux disorder and other gastrointestinal problems, intestinal distress and irritation from laxative abuse, severe dehydration from the purging of fluids. That's another thing. When you vomit, and even when you go to the bathroom and take a bowel movement, you lose a lot of fluid. So you have to constantly refurbish your body with fluids like Gatorade, Powerade, because your electrolytes are in that fluid, and you need to replenish your body. And if you don't replenish your body, you're always going to feel thirsty, and without proper fluid, your body's going to be weak as well. That's the same way you're going to feel if you walk out in this 90-degree heat that we had here in the Chicago area. If you don't replenish yourself, there's a chance that you're going to have a heat stroke. And the next thing I'm going to mention, I talked about electrolyte. Well, you're having an electrolyte imbalance. Too low or too high levels of sodium, calcium, potassium, and other minerals, which can lead to stroke or heart attack, just as I mentioned earlier. Now, the third is what we call a binge eating disorder. Now, people with a binge eating disorder lose control over his or her eating. Unlike bulimia nervosa, periods of binge eating are not followed by purging, excessive exercise, or fasting. As a result, people with a binge eating disorder often are overweight or obese. Binge eating disorder is the most common eating disorder in the United States. Now, the symptoms with the binge eating disorder include eating usually large amounts of food in a specific amount of time. That's right, eating unusually large portions of food in a specific amount of time. Eating when you're full or not hungry. Eating fast during binge episodes. Eating until you're uncomfortably full. Eating alone or in secret to avoid embarrassment. Feeling distressed, ashamed, or guilty about your eating. Frequently dieting, possibly without weight loss. In other words, you're trying to diet, but you're wasting time because you're not seeing the fruits of your labor. In other words, you're not losing weight by the diets. Now, with all these disorders, there are risk factors that go along with what I'm talking about tonight, eating disorders. Now, eating disorders frequently appear during the teens or young adulthood, but may also develop during childhood or later in life. Now, these disorders affect both genders, although rates amongst women are 2.5 times greater than amongst men. Like women who have eating disorders, men have a distorted sense of body image. For example, men may have muscle dysmorphia, a type of disorder marked by an extreme concern with becoming more muscular. Researchers are finding that eating disorders are caused by a complex interaction of genetic, biological, behavioral, psychological, and social factors. The researchers are using the latest technology and science to better understand eating disorders. One approach involves the study of the human genes. Eating disorders run in families. Researchers are working with the DNA variations that are linked to the increased risk of developing eating disorders. Brain imaging studies are also providing a better understanding of eating disorders. For example, researchers have found differences in patterns of brain activity in women with eating disorders in comparison with healthy women. This kind of research can guide the development of new means of diagnosis and treatment of eating disorders. Now, with every disorder, we talk about the symptoms, we talk about the signs and the risk factors, but eating disorders can be treated because there are treatments and therapies available, but you have to want them. Now, adequate nutrition, reducing excessive exercise, and stopping purging behaviors are the foundations of the treatment. Again, adequate nutrition, reducing excessive exercise, and you must stop with the purging behaviors. And once you do that, you have put together the foundations of treatment. Now, treatment plans are tailored to the individual's needs and may include one of the following. There's also medication, of course, but to the mental side, there's individual, group, and or family psychotherapy, medical care and monitoring, nutritional counseling, and of course, medications. Now, when it comes to psychotherapies, psychotherapies such as a family-based therapy called the Maldsy approach, that's where parents of adolescents with anorexia nervosa assume responsibility for feeding their child, appear to be very effective in helping people gain weight and improve eating habits and moods. To reduce or eliminate binge eating and purging behaviors, people may undergo cognitive behavioral therapy, and I'm going to do a video on CBT again so everybody understands what CBT is, which is another type of psychotherapy that helps a person learn how to identify distorted or unhelpful thinking patterns and recognize and change inaccurate beliefs. Now, of course, when it comes to medications, evidence also suggests that medications such as antidepressants, antipsychotics, or mood stabilizers, and they've of course been approved by the U.S. Food and Drug Administration, known as the FDA, may also be helpful for treating disorders and other co-occurring illnesses such as anxiety or depression. Now, if you want more information about what the FDA is doing, check out their website at http://www.fda.gov for the latest information on warnings, patent medication guides, or newly approved medications. And that's my commentary for this edition of the 411 Talk Zone Radio Show for this evening, Monday, June 12th, 2017. You can tune into the 411 Talk Zone Radio Show every Saturday from 6 p.m. to 8 p.m. on Blog Talk Radio, and had a fantastic show this weekend. I did it on the road. I traveled 11 and a half hours from Portage, Indiana, to see another subscriber of mine, Big Body Matt Coley. Subscribe to his channel. We did a nice live show on the road. You can also check the video that he posted on his channel. And that's what I'm going to start doing, reaching out to the real subscribers. That's right, not the ones who will look at a video and just say, I subscribe. The ones who are actually supporting your material, who watch it frequently. So, if you want to be a participant on my radio show, the guest calling number is 215-383-5785. And if you like my videos, please share and subscribe to the 411 Talk Zone Radio Show right here on YouTube so I can continue to give you quality information for educational purposes from a professional and, of course, mature perspective. Now, on this channel, as I tell you, we keep everything positive here at the 411 Talk Zone Radio Show. So I don't engage in debate. I don't talk about the black community because there are enough YouTubers doing that. I'm doing something different. This is my niche, health topics, because every community needs to focus on health, mental, and psychological topics. So this is why you don't hear me in the debates or the Google Hangouts getting emotional or participating in the drama or unnecessary bickering, because it's counterproductive. You get nothing done. In fact, a lot of issues that are presented, we already know about them, but we just don't want to solve them, some of them. But if you're interested in understanding health topics, Sigmund Freud, Darwinism, this is the channel that you will get that information from, because I keep it positive and realistic. Because what I want everybody to do, no matter where you come from, particularly you millennials out there, you need to understand how the real world works. And you'll get that on this channel. Because I'm giving you the information that I've researched, plus my own personal experiences. Because knowledge is power, but you want to be positive with how you deliver the message. You can be realistic, but I like to keep my audience engaged. And on that note, if you have a business, a topic, or a new YouTube channel that you would like for me to discuss on YouTube or on my Blog Talk Radio show, the 401 Talk Zone Radio Show, please email me at lej6521@gmail.com. And if you have a comment, please leave your comments in the comment section under the video. But make sure that your comments are pithy, no bloviating, pettifogging, or filibustering. That's it for this video. Till next time, my name is Leon Jones. Remember, please be gentle and respectful to each other, and have a wonderful and blessed night. Good night.